How safe is awake craniotomy for brain tumor removal? Imagine having brain surgery while you're awake. It might sound scary, but awake craniotomy is actually a very safe and effective way to remove certain brain tumors. This procedure is especially useful when the tumor is near areas of the brain that control speech, movement, or sensation. During the surgery, the patient stays awake and alert, which allows the surgical team to monitor brain functions in real time. This way, they can carefully remove as much of the tumor as possible without harming vital parts of the brain. Research shows that the risk of permanent neurological problems after an awake craniotomy is quite low. Only about 1.7% of patients experience lasting side effects, which is lower than traditional brain surgery under general anesthesia. Because the patient is awake, the surgeon can perform brain mapping during the operation. This process helps identify critical areas of the brain and guides the surgeon to avoid damaging them. As a result, surgeons can maximize tumor removal while protecting essential functions like speech and movement. After surgery, some patients might notice temporary issues such as weakness or speech difficulties. However, many of these problems improve over time. For example, in studies involving patients with brain tumors called glioblastomas, about 25% experienced neurological decline right after surgery. But by 3 months later, this number dropped to just 9%, showing that recovery is often possible. The procedure involves careful management of sedation and local anesthesia. Patients are kept comfortable and pain-free while remaining awake enough to participate in testing their functions. The entire surgery can last several hours, and afterward, patients usually recover in an intensive care setting before moving to a regular hospital ward. During recovery, close monitoring of vital signs and neurological status helps ensure safety. One of the main advantages of awake craniotomy is that it provides real-time feedback on how the brain is functioning. This helps reduce the chance of long-term damage and can even improve survival rates and quality of life by allowing more complete tumor removal. It is a well-established technique supported by many years of clinical experience and research. Of course, like all surgeries, awake craniotomy carries some risks. Outcomes depend on individual factors such as the location and size of the tumor, the patient's overall health, and the skill of the surgical team. Patients should have a thorough discussion with their neurosurgeon to understand the potential benefits and risks based on their specific situation. Overall, when performed by experienced surgeons, awake craniotomy is a safe and valuable option for removing brain tumors near critical areas of the brain.